How did your service delivery and field work in Uganda build upon your previous public policy experience?
Well, when I was working in Uganda, I had a chance to really see on the ground some of the issues that I was working with as a public policy person in New York, working at a desk. And I was working there, I was working on global issues, which are vitally important, understanding financing for research and building global momentum to make a vaccine happen. But when I was on the ground in Uganda, I actually got to meet the people who were closer to what's happening, and I got to interact with people at the clinical trial sites, which is where you are bringing together, you know, the science and the human aspect, and understanding who's really affected by HIV, and seeing sort of firsthand what it is that we're really trying to accomplish.
While you were working abroad in Uganda, you had an opportunity to work not only at the grassroots community level, but all the way up through the Ministry of Health at the national government level. How did that exposure shape your view of how problems are solved and how solutions are actually implemented?
In working in Uganda, I saw the value of really trying to understand and target each level of society. If you want that girl to get that vaccine that she needs, to understand what you need to do in the the halls of the Capitol, meeting with the Ministry of Health officials. And I had a chance when I was doing my graduate studies to put that into sort of a solid framework through this intervention mapping program planning model, which looks at how you understand the barriers at every level of society that are needed to create an environment where people can actualize their health needs. So you are not just looking at what do I, Gabrielle, or Erik need to do in order to maybe stop smoking or exercise or eat right, but what's happening in your household, what's happening in your community, and what's happening at the policy or society level that is going to make it easier or harder for you to do those things. And so this framework enables you to sort of systematically go through each of those levels and come up with an intervention at each level in order to affect that change.